What is the link between gluten and blood sugar? Imagine a plate filled with bread, pasta, or baked goods. Many of these foods contain gluten, a protein found in wheat, barley, and rye. Now, gluten itself does not directly cause blood sugar levels to spike. But here's the catch. Many gluten-rich foods are high in carbohydrates, which do influence blood sugar. For people managing diabetes, controlling carbohydrate intake is key to keeping blood glucose steady. So, it's not just about gluten but about the total carbs in your meal. If you have type 1 diabetes, you might also face a higher chance of developing celiac disease, an autoimmune condition triggered by gluten. When someone with celiac eats gluten, it damages the small intestine, making nutrient absorption harder. For these individuals, sticking to a strict gluten-free diet is essential to avoid symptoms and intestinal damage. Interestingly, following a gluten-free diet can sometimes improve how the body handles glucose and increase insulin sensitivity. For those with type 2 diabetes, the connection is less clear. Research suggests that eating gluten at typical levels does not increase the risk of developing type 2 diabetes. In fact, some studies hint that gluten might even be linked to a slightly lower risk. But switching to gluten-free foods does not automatically lower your blood sugar. In fact, many gluten-free products are processed and can be high in sugars and fats, which might lead to higher blood glucose levels if eaten in excess. Gluten can also affect your gut health by changing the bacteria in your intestines and making the gut more permeable. This could lead to inflammation and insulin resistance, which are factors in diabetes. However, these effects are still being studied and are not yet fully understood. When planning meals for diabetes, focus on the carbohydrate and calorie content of foods, not just whether they contain gluten. Many gluten-free options, like whole grains or lower glycemic index foods, can help keep blood sugar stable. Always watch portion sizes because even gluten-free foods can raise blood sugar if they contain lots of carbs. In summary, gluten itself does not raise blood sugar, but foods containing gluten often do because of their carbohydrate content. People with type 1 diabetes should be cautious if they have celiac disease and follow a gluten-free diet. For others with diabetes, gluten-free diets are not necessary unless there is an intolerance or celiac diagnosis. The main goal remains managing carbohydrate intake carefully to keep blood sugar levels in check.